This mind map correlates the common neurological signs and symptoms of motor control impairments, cognitive and perceptual impairments, and sensory impairments. Motor control begins in the primary cortex, which is located in the frontal lobe. The primary cortex initiates voluntary movement and controls the contralateral side of the body. It is here that upper motor neurons generate action potentials that travel through descending motor pathways, primarily the corticospinal tract, which is the main pathway for voluntary movement, carrying signals from the brain to the spinal cord. These signals are regulated by the basal ganglia. The basal ganglia are a group of subcortical nuclei that regulates the initiation of movement and inhibits involuntary movement. In conjunction with the cerebellum, contributes by refining voluntary movements, ensuring smooth and coordinated movement patterns, along with maintaining postural stability. These structures all communicate with the brainstem, which is comprised of the midbrain, pons, and medulla oblongata to travel up the spinal cord. The spinal cord contains ascending tracts which transits sensory information to the brain and descending tracts which deliver motor commands to the body. At the spinal cord, lower motor neurons exit the spinal column at the anterior horn and interact directly with skeletal muscles. Damage to the pathway will result in a disruption to the transmission and coordination of motor signals. Damage to the motor cortex or upper motor neurons can result in spasticity, muscle weakness, and a loss of fine motor control. This will occur on the opposite side of the body to the injury. When looking at an injury to the basal ganglia, this will cause an inability to start and stop movements. This will cause tremors, rigidity, and the slowness of movement known as bradykinesia. Damage to the cerebellum will result in poor posture, difficulty with smooth, controlled movements, and ataxia. Any damage to the spinal cord or lower motor neurons will result in flaccid paralysis to the muscles, muscle atrophy. Damage to any part of this system will have a lasting effect on their fine motor skills, along with their ability to manufacture purposeful and coordinated movement patterns. This will greatly affect their everyday life. The impact this impairment will have on a person's activities of daily livings, or ADLs, are very prevalent. Depending on where the injury has been sustained will dictate the effect it will have, as mentioned previously. Most notably is the impact on the person's gross and fine motor skills. This becomes increasingly difficult as menial tasks such as picking up a pen become very difficult. Furthermore, things such as postural changes can become very uncomfortable and can then influence things such as their walking gait. With an altered walking gait, they can then become a falls risk, which will influence how they exist day to day. These are just some examples of how a motor control impairment can affect someone on a daily basis. Some examples of specific conditions that experience this are Parkinson's disease, as an injury to the basal ganglia disrupts the ability to start and stop movement, resulting in a tremor, which is a symptom of Parkinson's disease. Stroke is another condition that experiences this. A stroke mainly affects the motor cortex or the corticospinal tract, resulting in hemiparesis, spasticity, and a loss of fine motor skills. Multiple sclerosis affects the upper motor neurons, cerebellum, and spinal cord, causing muscle weakness, atrophy, spasticity, ataxia, and impaired coordination. These are just a few examples of specific conditions that experience motor control impairments. When looking at treatment for motor control impairments, there are a few options. Electrical stimulation can be used to help assist muscle contraction. This is to help with movement and potentially retrain the brain and nervous system to help with neuroplasticity. Bimanual training looks at improving hand coordination through repetitive movements to again aid in helping create new neural connections. In conjunction with this is strength training to again help repetitive movement and muscular contraction. Finally, task-specific training is a focused approach on functional everyday movements and repeating that to build new neural pathways and connections, gaining that neuroplasticity. Cognitive and perceptual impairments arise from dysfunction in various interconnected regions in the brain that are responsible for processing, responding to sensory, and thought-related information. When looking at cognitive impairments, the frontal lobe plays a vital role in attention and problem-solving. The temporal lobe, and specifically the hippocampus, is crucial for memory and understanding language. Also, the limbic system, which includes the amygdala and the hippocampus, regulates the emotional responses and formation of memories. When looking at perceptual impairments, the partial lobe is crucial for spatial awareness and body orientation. The occipital lobe is in control of visual processing. It plays a role in interpreting and recognizing objects or navigating environments. Both partial and occipital lobes work very closely to process and interpret sensory data accurately. It is the interhemispheric communication through the corpus callosum, which allows integration of cognitive inputs. Damage will often result with lesions in white matter, which disrupts the communication between the brain regions, or in the grey matter, which is in the brain's processing center. Damage to the axons and myelin slows down the transmission of electrical signals between neurons, only further impacting the brain function. Some of the areas involved in this are the partial lobe, temporal lobe, occipital lobe, thalamus, and basal ganglia. These lesions lead to a range of weakened functional abilities and impact on ADLs. The impact this impairment will have on a person every day will be quite significant, as it will impact their mental processing and sensory interpretation. People with cognitive impairments may struggle with memory, problem solving, attention, and aphasia. This will result in them finding it difficult to follow a routine, take medications correctly, or even make a meal. This can cause them confusion, increasing risk of poor decision making. When looking at perceptual impairments such as spatial awareness, visual processing, and apraxia can have an impact on tasks such as dressing themselves, using tools or utensils, and self-care. Individuals with visual spatial neglect may ignore one side of their body, which can lead to improper self-care and poor hygiene. Some specific conditions that experience this are stroke. Stroke patients can experience memory loss, attention deficits, and unilateral neglect. Additionally, direct trauma can elicit similar symptoms. Conditions such as Parkinson's and dementia experience cognitive slowing and visual perceptual changes and disorientation, respectively. Many of the treatment options for cognitive and perceptual impairments aim to create a response in the nervous system. For example, sensory stimulation triggers these receptors as it aims to help neuroplasticity and aid in triggering the perceptual impairment. Similarly, with visual scanning, by actively scanning for something specific, the frontal lobe is firing neural pathways by having to remember what it is they are scanning for and solving the problem of finding the specific thing. Additionally, mirror therapy is a good option to try and trick the brain into thinking the affected limb is moving in an attempt to rewire neural pathways to achieve neuroplasticity in the affected side. Sensory inputs come from sensory receptors found throughout the body and convert inputs such as pressure, temperature, chemical stimuli, and pain. These receptors being mechanoreceptors, thermoreceptors, chemoreceptors, and nociceptors, respectively. These electrical signals travel along the afferent neurons to the dorsal root ganglia, then into the spinal cord or brainstem. As the signal ascends, it links in the thalamus. From the thalamus, the signal moves to the primary somatosensory cortex in the partial lobe. Similarly, the optic nerve travels through the optic foramen, meeting in the thalamus. Damage throughout this process can lead to various impairments and conditions. Damage to the receptors themselves that are located throughout the body, the input can become weakened or absent completely. This can lead to a multitude of risks, as it is essential to detect changes in the environment. Building from that, it can impact the transmission of the signals to the spinal cord or brainstem, which can lead to numbness, tingling, or pain. With this damage to chemoreceptors, thermoreceptors, chemoreceptors, nociceptors, and optical nerves, it can severely impact an individual's function. They can experience visual impairments, problems with coordination, balance, and gait. They can have abnormal senses, a lack of sensation, hypersensitivity, reduced processing speeds, and allodynia. These sensory impairments can have a serious impact on an individual's daily life, as it is disrupting the body's ability to interact with the environment effectively. The visual impairments make it much more difficult to navigate safely, especially new places. Along with this, appropriate self-care such as medication and also hygiene becomes difficult. Impaired vestibular systems, which affect coordination, balance, and gait, will make daily activities challenging, as it will then limit their mobility. A lack of sensation will severely impact their daily life, as it can affect their fine motor skills, making simple tasks difficult, but their awareness of an injury or pressure will be reduced. This can result in a multitude of further risk factors in terms of infection and maintaining skin integrity. Also, a reduced sensory processing speed makes it more difficult to respond to additional stimuli, making it harder to respond to the environment they're in and adapt to changes. Some examples of specific conditions that experience this are peripheral neuropathy, which can impair signal transmission, diabetic neuropathy, which affects the mechanoreceptors, multiple sclerosis, which has an effect on the ascending pathways up the spinal cord. Additionally, conditions such as sensory processing disorder and autism spectrum disorder are influenced by sensory impairments. The treatment options for sensory impairments look to slowly expose the individual to said stimuli to aid in the neuroplasticity. Strategies such as sensitization, habituation, and repeated exposure, By doing this, they become more comfortable with the initial input and are less overwhelmed by this. Other interventions such as sensorimotor integration and mirroring have been seen to be helpful for sensory impairments. As can be seen in many of these conditions overlap and have similarities in their neuroanatomy and neurophysiology, their impact on individuals, or even the treatment options. Treatment options such as mirroring are useful for people with cognitive and perceptual conditions, but also those with sensory impairments. Similarly, with motor control and sensory impairments having impacts on their gait and balance. Whilst it is important to be aware of each impairment individually, it is also important to be aware of how they all interact, as many may possess multiple of these signs and symptoms.